Good morning, everyone. This is Dr. Bruce Shelton on November the 1st, 2008. The subject of this morning's lecture is detoxification and drainage. In the homeopathic world, when you give the patient a correct remedy, it stimulates the body to discard or throw off some type of a toxin. And that toxin needs to be able to leave the body unimpeded in a form that will pass through all of the barriers on the way out. Now, first of all, the term drainage means the departing of the toxin from the body. And the drainage organs of the body are the ones you would expect them to be: the kidneys, the liver, the gastrointestinal tract, and the lymphatic pathways that take things out of the body. Now, the subject of detoxification indicates that the toxin or poison needs to be in a form that is able to pass through the barriers, such as fat-soluble things cannot pass through membranes that only allow water-soluble things. So the process of converting a poison from a form that will not pass through the barriers, through the mucous membranes of the various organs, and that conversion is called detoxification. So step A in treatment of any of the various treatments and diseases that we have are called detox and drainage pathways and formulas. And the one thing that a lot of people forget to do is they dive right into the problem itself. The patient is suffering from something and doesn't want to wait until the right order of business occurs. And I tell people, try and imagine you're at your kitchen sink washing your dishes without the dishwasher. You wash the dishes, you rinse them off, you put them in that little drain board that goes in the sink, and what's the last thing you do before you leave the sink to go watch television while the dishes are drip drying? That's right, you turn on the garbage disposal. Well, if the pipe coming out of the garbage disposal is clogged up, when you turn the garbage disposal on, it goes roar, and it splashes all the stuff back up on the dishes. So it is very important that the pipe that comes out of the bottom of the garbage disposal be open and clear. Well, the same thing is true about the kidneys, the liver, the gastrointestinal tract, and the lymphatics that have to carry the products of waste outside the body. Okay, so you understand the concept. And the other thing is, there's always that little grinder mechanism in the garbage disposal. If things aren't able to pass through that, then the garbage disposal is going to get clogged up and the process is not going to work. Well, detoxing would be putting Drano into the sink. You follow it? The detox procedure turns the garbage into a form that's going to pass through while you're opening everything up. So detox and drainage in a medical sense is a very important process. Now, the thing you need to remember, which we always taught as the basic tenet of Dr. Reykjavik, who's the father of homotoxicology, he literally stated that when people are detoxing their system, as the poisons move to new and new layers on the way out of the body, sometimes those layers appear to be getting sicker, such as your ankle swells up. Well, why would the ankle swell up? The ankle swells up because some type of a toxin is leaving the ankle joint and going into the soft tissues. And regular medicine, the regular allopathic drugstore medicine, would give that patient cortisone and anti-inflammatories in a way of suppressing the swelling, when in fact what really needs to be done, since this is a natural process, is to open up the lymphatics that'll help that poison drain up the leg so it gets to the kidneys, and then the kidneys will be able to detox and drain the system as well, and let the poisons leave the body. That's the difference between homeopathic medicine and allopathic medicine. Homeopathic medicine recognizes that the body is going through a natural process when things like ankle swelling occur or breathing problems occur. Breathing problems occur because the lungs are in the middle of a pathway of something trying to be thrown out of the system, and instead of suppressing it, you need to aid it and make it happen faster, so it ultimately stops, but then the problem is gone. So the question is, how do we do detoxification and drainage? The simple answers are the best answers. Now, of course, the answer is homeopathy. And the various companies have managed to produce programs and procedures that they recommend using. And I'm not going to talk about products here today, although I happen to have developed a new line of remedies for a company called Deseret Biologicals, which, with my experience of my past knowledge of homeopathy, I feel is the best way. But I feel that the best way is the one that is kinder and gentler on the patient in both their physical symptoms and on their pocketbook. And I have come up with ways of combining remedies, like for instance this bottle right here, which I've added 6 different ingredients to that are useful for detoxification and drainage, that help the liver, the kidneys, the lymphatics, and the gastrointestinal tract. And what I do is I take a bottle of water and I take some of the medicine and I add it to the bottle of water and then put the cover on the bottle and succuss it. And now every time I take a sip of this water until I finish the bottle, which I should by the middle of the day, I will be getting a dose of the medicine. So in homeopathy, dosing is time related as opposed to volume related. One of the things I like about Fiji water, by the way, is that it contains silica, which is a natural water softener that helps your body absorb things. I've been to Fiji. I'll have to tell you that story someday. I've been to the factory where they make this. This is literally, and I get no money from Fiji water at all, this is literally the best water that's on the market right now. It tastes good, and with the natural silica that's in it, helps everything else that you put in it work better. Well, there are other ways of detoxification. This is a product that I've improved upon for Deseret called systemic drainage. Wait till you see my new formulas. They're coming down the road. And then there's the detoxification of your brain and balancing of the brain, which is very important with the products that we've developed for NAET. That is extremely exciting that I ask you to go watch the other videos that are on the site. And then to balance your minerals, I use my Quinton, which is the magical mineral containing seawater from the Atlantic Ocean off the coast of France. But the point of this lecture, and it's very short right now, is that before you take any vitamins, before you take any hormones, before you do anything that you consider in a natural sense, detoxification and drainage is always the first thing to do. It avoids side effects, it makes everything work better, makes it work faster, and while there's many ways to do detox and drainage, it is important that you do it first. And that means maybe for a day, maybe for 2 days, maybe for a week. I had an elderly patient that came in the office last week. I'm going to detox and drain her for a month before I give her her definitive medicines, because I don't think she can handle a strong normal defense that the average person could just start on the same day. Detox and drainage, very important. Please remember that I said it. Please practice it. Let's do everything else that we're saying on the site, and we'll see you again next week. Thank you very much.